Hello, everybody, and happy Wednesday. I apologize for my brief delay in getting another video up. I was out of town and then I was kind of stricken by an upper respiratory bug. So I'm on the tail end of that, and I apologize for my voice, but we're getting there. So thank you all for sticking with me here the last couple weeks, not being with you. I'm glad that I'm back. I wanted to touch on a topic that I don't know that I have dived into too much detail before, but I think it's really important, and that is oral antibiotics use in acne. It's actually a very widespread treatment. Many doctors will deem it a standard of care, in a stepwise approach. It won't necessarily be the first step, but typically it's definitely a potential consideration on the table. And I wanted to point out a few of the concerns of utilizing oral antibiotics for acne. So let's kind of go over some of those concerns now. And if you have any questions, feel free to put those in the comments or message me afterwards. But first and foremost, as most of you are aware, there is a growing problem in this country and in other countries too with antibiotic resistance. And so what happens with that is the bacteria over time get a little bit smarter and figure out our antibiotics and become resistant to it, such that they have, mutated enough that they are no longer impacted by the antibiotic. And then we, promote resistance. When we overuse antibiotics for conditions that don't necessarily require antibiotics, that is a concern. And so we have what we call superbugs, like MRSA and VRE and all of these, kind of what we call superbugs, which means they're resistant to antibiotics. And it's becoming a growing concern. So the more that we utilize antibiotics for conditions that we don't necessarily need to, that will become a continuing growing concern and will become a larger problem where, our array of antibiotics will not work at some point. And then we're going to be in real trouble. So that's one concern. The other concern is how it is impacting our natural gut flora. So we actually have 10 times the amount of bacteria in our body that we even do cells in our body. So bacteria are a huge component of the health and, a microbiome of our bodies, and we impact that greatly when we take antibiotics for short term, but definitely for long term. What typically happens is when a person is put on antibiotics for acne, it's maybe intended to be for 2 or 3 months. However, it typically continues past that for whatever reason. Sometimes there's a change in doctor and the new doctor just doesn't want to mess with what's been working. Sometimes there just hasn't been follow-up, so nobody's been told to stop the antibiotic. Whatever the reason is, typically what we see is upwards of even up to a year and beyond of use of oral antibiotics for acne. And that can have a huge impact on our natural gut flora, which can impact a lot of other conditions. We know now that our gut is, sort of our second brain. And when we affect that bacterial population, both good and bad, we affect a lot of things. When we, put ourselves at increased risk for leaky gut syndrome, we put ourselves at increased risk for inflammation. And so it's not a small, it's not a small benign issue. It can really become a much larger health issue by doing that. There have been observational studies, and again, when I say observational, that means that it's not a cause and effect thing, or at least we don't know that yet by studies, but there's been observational studies suggesting that this change in microbiome can put us at risk for upper respiratory tract infections. It's even been linked to an increased risk of breast cancer. Again, these are observations, and so we have links, but we don't have causation. However, it just puts into makes us kind of put a spotlight on the fact that these are not, they're not something that we should take lightly. We should definitely pay attention to how long people are on oral antibiotics for acne and realize what those consequences can be. Hi, Carrie. So we've talked about a few concerns, and I really wanted to highlight that change in gut microbiome because that can really be a huge one. The other issue is that by using oral antibiotics for acne, we aren't attacking all of the different factors, causative factors of acne, right? So we know that bacteria is one of many. So is oil overproduction, so is clogged pores, and so is inflammation. So when we utilize oral antibiotics, we are only attacking one component of the acne cycle, and so it's not the most effective approach. Now, sometimes we will have, oral antibiotics in use with other products, and so if we have a comprehensive regimen, we may be attacking some of those other causes. But in general, what may happen is a lot of people will end up on just oral antibiotics and not really utilizing other products to attack those other parts of the cycle. And so it becomes not a very great comprehensive approach. The other issue is that a lot of people will find that because of that change in gut microbiome and the change of bacteria population, they will sometimes have a return of acne that is worse than their original bout of acne when they come off of the antibiotics. So sometimes we have sort of a rebound effect. And so that's another bad side effect, another bad potential. And of course, as I just mentioned, side effects of antibiotics. Antibiotics come with side effects. You have the potential for yeast infections because, again, the effect on the microbiome. Certainly with the tetracyclines, you've got GI disturbances. You'd make sure, GI tract not feel great. You can have diarrhea. And so it's definitely got its downsides. Will it, in the short term, help with the bacterial population that causes acne? Probably. So you'll see some beneficial effect. But the point here is to think through and be educated on the potential downside, so you are educated to make that decision for yourself if that comes up as an option. Maybe a topical antibiotic option, a topical product that has antimicrobial activity may be your better option or your preferred option, in addition to other products that would be beneficial towards all of those parts of the cycle. So I just wanted to point out some of those concerns so that you are aware. If you know anybody with acne who is either currently or considering oral antibiotics, feel free to share. I think this education is important. A lot of people just don't know. So feel free to share. It's set to public, so you're welcome to do that. And I will look forward to seeing you all next week. Feel free to send me your suggested topics and have a wonderful rest of your week.